Virali, for taking time out for us today. So today we'll be talking about oral hygiene. When should parents start it, and how do we go about it? Because this is a question that was there in my mind as a new parent on how do I take care of my baby's teeth.
My favorite topic because when a baby is born, everything is taught to us, but oral hygiene as a perspective is so ignored. Like nobody teaches the new mom how to take care of a baby's mouth or how to take care when the first tooth comes out. So I'm really excited to talk about this today.
Super. So let's shoot with the questions. So when should parents start taking care of their teeth, of their baby's teeth?
So the first tooth can come out in the mouth at 6 months of age, or it can be later on also. Sometimes your baby will not cut the teeth as young as 1 year of age also. It comes at like, which is perfectly normal. It's just a very random milestone, nothing to relate to it. So the brushing should start when the first teeth is out in the mouth, but the oral hygiene can start as young as 6 months of age.
Okay.
So when I say oral hygiene, so basically when the baby has no teeth, just gum pads. So cleaning of the gum pads is what is important. I want to actually show you how exactly this is done. So we have a little baby over here.
Yeah.
And so while the baby has no teeth, you can use few things, few pre-brushing tools. So pre-brushing tools can either be like an extremely soft toothbrush like that,
Okay.
or a finger brush.
Okay.
A finger brush is a pre-brushing tool, not after the teeth comes out, or a soft cloth like that, muslin, a soft muslin cloth. So with respect to a muslin cloth, how we can do is the mother can just wipe it around the finger, wrap it around the finger like that, and wipe the baby's gum pads. That's all that is required. Or an easier method is just take the finger brush like that. That can be used to clean the gum pads like that. Or any of this soft toothbrush can be used just to clean the gum pads. Now, when the tooth is out in the mouth, that's when we have to use a proper toothbrush and a toothpaste. So this soft bristles brush will not work. This is what is going to work. If you notice, that is very soft. See how stiff this is.
Okay.
Because when the teeth are out, this will not be able to effectively remove plaque. We need something stiffer like this.
Okay.
So then what a parent needs to do is, after the teeth are out in the mouth, what the parent needs to do is the baby can lie down on the parent's lap, and then the parent needs to flip the lip up so that they can clearly see the teeth. Not just pull the lip like that, but properly with a finger flip it up.
Okay.
Brushing along the gum lines,
Hmm.
downwards, inside out. Repeating the same thing onto the bottom half teeth. So basically what we say is brush the top front teeth, bottom front teeth separately.
Hmm.
So again, lifting the lip up, gum lines upward, inside out. So right now this seems like a task. Oh my god, how am I going to do this? Right?
Yeah, I was going to say that.
So when introduced early, the baby gets used to it because even
Yeah.
bathing was not fun for your baby. Day
Yeah.
one, right? All babies cry because it's something new to them. So when introduced as early as 6 months of age, it becomes a part of their routine.
Hmm.
Then they themselves would come, oh, this is something that is required to be done. So initially, even if they have no teeth at the back, just for them to get used to it, we can just move the toothbrush once
Hmm.
so that the baby gets used to someone working in their mouth. That is what is important. So the whole idea of getting your baby to help you brush the teeth is basically to introduce it early so that it forms as a routine for a young baby itself.
Got it. Got it. And the toothpaste that you talked about,
So
normal.
initially, when the tooth is out, any fluoride-free toothpaste can be used for the child. The
Okay.
quantity that you use is very small. It's like a rice grain size of toothpaste. And more importantly, with your thumb, you can just push the paste into the brush like that.
Okay. Okay. And obviously, rinsing will not be possible at that point. So,
The child has not learned to spit as effectively.
yes.
So,
Yes.
rinsing is fine. You're anyway using a fluoride free toothpaste. The quantity that is there is extremely less. It's like just a rice grain size amount.
Right.
So, even if you wipe your baby's mouth again with a soft cloth or a towel, it's fine.
Got it. Got it.
Okay.
And between 0 to 6 months, it's not required. Cleaning of the tongue, cleaning of the like the gum pads, nothing is
Not
required.
required. Not required at all. Most of the
Okay.
time, the baby is on breast milk only, right?
Yes.
Between 0 to 6, no solids particularly have been introduced to the baby. And basically, no teeth are there, right? Where anything can pool around.
Correct.
So, 0 to 6 months, it's not required at all. After
Yeah.
6 months is when you can start. Like the minute you like plan on starting solids, that's when you need to plan how are we going to clean a baby's mouth too.
Got it. Got it. Sure. And like, how many times do you do this? Like morning, evening? How
Twice
do
a
you go
day.
about it? Twice a day.
Twice a day. And it
Got
becomes
it.
like a routine for the baby as well. Oh, twice a day, this is an activity that happens, like eating,
Right.
like bathing, like any
Right.
other activity which is
Correct.
happening, which they are looking. I mean, they learn from us also, right? So they are watching us do all these activities. So they know it's a part of their routine.
Yeah.
So this also becomes one
Yeah.
of one of those activities.
Yeah, I can for sure say that introducing this with toddlers is too difficult at this point.
Obviously, it's too difficult.
Yeah.
Because they are not used to it. In
Yeah.
their minds, it's like you have not done this for so much time of my life.
Yes.
Why are you introducing it to me right now? Why is it important? I don't understand. I mean, I
Yeah.
had teeth long before. I mean, obviously, they are not
True.
going to understand that part.
Yeah.
So when introduced early, it just becomes more into their routine.
Got it. Got it.